Senator Warren, and then Senator Blackburn.
Thank you very much, Mr. Chairman. I also want to say welcome to the Alzheimer's Association. I wore my Alzheimer's purple today. We have a very active group in Massachusetts, and I just want to say a special thank you for all of the advocacy you do on behalf of so many people we've lost to a terrible disease. So thank you. I want to talk today also about Medicare Advantage. You know, every February, the federal agency that runs the Medicare program releases a report outlining how Medicare Advantage, or MA, insurers are going to be paid for the following year. MA is a program that allows private insurance plans to offer Medicare benefits. Now, taxpayers pay these insurance companies a set amount per beneficiary, and this amount can go up if the beneficiary is sicker. The more diagnosis codes that a beneficiary has, the higher the payment. And whatever insurers don't spend on care, they actually get to keep. These companies have built entire businesses around making beneficiaries look as sick as possible, and unsurprisingly, government watchdogs have discovered widespread abuse. This year, CMS made a few updates to ensure that the government's payments more accurately reflect what it actually costs to pay for the care for beneficiaries in this program. And in response, the insurance industry has kicked into overdrive, sending an army of lobbyists to claim that the changes will hurt Medicare. So let's go through this. Let's start with the basics, Mr. Secretary. Under your proposal, will total payments to insurance plans that run Medicare Advantage go up or down?
Total payments will go up.
So they will go up. CMS is proposing to increase payments to MA plans next year. In other words, the insurance companies overall are going to get more taxpayer dollars, not fewer. But insurance companies want a lot more taxpayer dollars, not just a little more. So they're kicking and screaming, and they even shelled out millions of dollars for a primetime Super Bowl ad opposing the proposal. Now, these Medicare Advantage companies are also peddling industry-funded studies that claim Medicare premiums would go up and benefits would be cut if your proposal is finalized. Mr. Secretary, are those claims accurate?
No, they are not. Benefits are not cut.
All right. So numerous experts agree with HHS's assessment. When Medicare Advantage was created, the insurance companies argued that they could provide better care than the federal government at a lower cost. But for years now, MA plans have been using a long list of tricks and games to take advantage of loopholes in the government's payment rules to squeeze literally hundreds of billions of extra dollars out of the program. Researchers at the Kaiser Family Foundation found that profit margins for MA plans are double those for other kinds of insurance. In other words, because of lax rules, running Medicare Advantage plans is a lot more profitable than running any other type of insurance plan. And the insurance companies don't want the party to end. So, Mr. Secretary, are the private insurance companies that run Medicare Advantage actually delivering health care for seniors at a lower cost than traditional Medicare program run by the federal government?
The numbers show that it costs more to provide care to seniors in Medicare through the managed care Medicare Advantage program than through the traditional program called fee-for-service.
So the cheaper way to do this is actually just to run people through the Medicare program. It's not to say there aren't some programs that work with Medicare Advantage, but overall, that's what the data show?
Yeah, we're talking overall. So if you lump everyone who's in the Medicare Advantage program, the managed care program within Medicare, and those who are in the traditional Medicare program called fee-for-service, the per beneficiary cost is higher under managed care, or what we call Medicare Advantage.
Exactly the reverse of what they promised they would deliver. They said, hand it over to us and we'll do this cheaper. You know, in fact, according to the Medicare Payment Advisory Commission, which is the independent congressional agency that studies Medicare, the private insurance companies running MA have never delivered health care at a lower cost than traditional Medicare in the entire history of the program. So I just want to say, I urge CMS to finalize this proposal. I can't get an ad on the Super Bowl, but I hope that having you at this hearing will have some influence on this. It's important to take these steps to strengthen Medicare. I also want to say, I don't think it's enough. CMS needs to double down on its efforts to crack down on industry abuses in the MA program. I stand ready to work with you and to help you do that to ensure that Medicare beneficiaries get the care that they have rightly earned. Thank you, Mr. Secretary.
Thank you,
Mr.
Senator
Chairman.
Warren. Senator Blackburn.